Okay, it says that we are recording. So again, welcome everybody. My name is Monica Sanders. I'm a provider network analyst at OCHN. One of my main responsibilities is credentialing the practitioner network within OCHN's purview. So I assist and schedule and do trainings for our core providers, our SUD providers, and now AVA providers. So there's going to be a lot of questions today. I want everyone to have an open conversation if there's something you don't understand or need clarification on. I don't want to just be talking to you guys for an hour, hour and a half. So questions are welcome. We are going to be focusing specifically on the BCBAs today. I know that many of you have other clinicians that you credential at your organizations and keep doing what you're doing, but for today's purposes, we are going to tailor it more to the BCBA practitioners. And so I will get started. I'm going to share my screen for the PowerPoint. We are. Okay. So today's scope of the training is we're going to do an audit overview of Credentialing 101, contract requirements, and what's acceptable proof documents that will meet the standards. So organizations and or individuals in a contractual relationship with Oakland Community Health Network shall ensure that staff possess current, valid, and appropriate credentials as required by position and professional domain, statute, or regulation. OCHN contractual providers must also ensure this competence of its organizational and direct service providers. Contract providers must ensure that staff directly or contractually employed meets all applicable licensing, scope, practice, contractual, and Medicaid provider manual requirements. For these purposes, we are going to focus on the Michigan Department of Health and Human Services credentialing standards, but you'll find some NCQA elements that overlap, and many of you guys do work with NCQA for your purposes, so some of this will not be any new information, but our policy aligns with both the state and NCQA, so that is what we ask of our network to be in compliance with those. So just a credentialing 101 is who in our network needs to be credentialed. In our policy and in the state of Michigan credentialing guidelines, these are all the clinicians that need to be credentialed. And as you can see, we're talking about board certified behavioral analysis today, but all these other license types are required to be credentialed as well. Okay. When someone is a new hire at your organization, they are going to go through initial credentialing, which is when all verifications should be completed prior to hire. Required and initial trainings must be completed as outlined. We know that there's a recipient rights training that must be completed face-to-face within 30 days of hire. I know that's changed a little bit because of COVID, but that is how the contract still reads. And then other initial trainings must be completed within 90 days of hire. So when we talk about the credentialing application process, we will talk a little bit about what initial credentialing application should look like versus a re-credentialed application, because many of us do a lot of these verifications prior to or at hire because we wouldn't want them starting at our organizations without some of those critical sanction checks, resume, background checks to be looked at prior to them starting. Re-credentialing occurs every 2 years. So that is a requirement of the state that, let's say I was credentialed here March 1st of 2020, that my re-credentialing would be scheduled for March 1st of 2022. So 2 years in between. NCQA does require 3 years, but because of our contractual obligations to the state of Michigan, we have to go with the more stringent guideline of 2 years. So the re-credentialing includes a review of the updated information that was obtained during the initial credentialing process. So we're going to move into starting to talk about the credentialing application. I know some of you have an application that you use. I know I tried rolling out an application in October of last year, but we're going to take a deeper dive and look at it today and what it's asking of the practitioner and you as the organization to verify for these employees. A credentialing verification checklist is now required as part of the application. Must include all the areas listed in the OCHN checklist. So what items are verified and the documents reviewed, the date it was verified, the initials of the staff who complete the verifications, and the signature, title, and credentials of the staff completing the verifications. And that might be more than one person. You might have a designated person in your organization that verifies the resume or the background checks, but maybe you have somebody that runs the state and federal checks. So those should all be outlined in that application that we'll take a look at here in a few minutes. So this is a copy of the older application. I am going to back out and show you a more recent one. Okay, I'm just changing my screen up so we can see it a little bit more clearly in the PowerPoint. It's very small. So this is the ABA provider credentialing application that I helped create for your network. For those of you who do not have an application process in place, this is something that the state of Michigan and NCQA both look at the time of a credentialing review. So you're going to see key items such as hire date, the degree of the practitioner, position names, what credentials are they applying for? Are they looking for a full or initial credentialing, a re-credentialing, a temporary or provisional? We have a section here for the credentials for the populations that apply to them, which for your network would be the ABA 0 to 21 years old. The liability insurance. Some of our practitioners in our network carry their own liability insurance, which is 100% okay. Some of our organizations cover their employees in their policy. So either way, this must be filled out. So even if, well, we cover all of our employees, that's great. You still have to write it on their application on what is their insurance carrier. This is the attestation that is required for all practitioners in our network. There is very specific language outlined in the Department of Health and Human Services contract, as well as NCQA, very specifically that they look for. And this language that I have embedded into the application is the exact language that they require. So as long as everyone checks yes here, then all those standards are met automatically, as long as this is completed prior to the credentialing decision. And we'll talk about that process as we move along too. So the practitioner is the one that would fill this part out. They would print their name, they would sign it, and then they would date that they're attesting that this is correct and complete information. And then this is the part where your organization is going to take the steps into completing the verifications. So I had changed this to credentialing representative. Previously, I had written HR. I know that not all, I've learned through my trainings through the Substance Use Network and the core providers that it's not necessarily only the HR that helps in supporting the credentialing decisions. So it's whoever your representatives are from whatever department, whether it's quality, HR, clinical services director, who's ever responsible is going to be filling this out. And we're going to go through these requirements slide by slide. I've broken it down into our PowerPoint. But this is what I was talking about when I said, you know, everything's going to have a verification date and then the initials of the person who looked at it. So if I'm coming to your organization as a new hire and I bring you my official transcript, and Jennifer Van Cleve is the one that does my verification for that, she is let's say it's on March 1st. She would date March 1st, 2021, and then she would just write her initials that she saw and has possession of an official transcript from the primary source, which is directly from the university, or, and we'll talk about some of those expectations. So the portal downloads via email, whether it's mailed a hard copy right to Jennifer herself, and what the expectation is if I were to bring it in a sealed envelope myself to my employer. So the attestation is covered here, these LARA license verifications. Some of these don't apply, but it's a general checklist because this covers our SUD and core providers as well. The OIG sanction checks, the state sanction checks, the national practitioner databanks, and reviewing the professional license, and other elements that we'll start to talk about, the performance eval, current job descriptions. And again, when I was talking about everything needs to match, whoever is verifying their initials in this column, they're going to be responsible for filling out the verified by here. So again, their staff name, their title, their credentials, and any additional staff. So I put room up to 4 staff. Which many people have about 2 or 3, 1 to 3, I should say, because some people do the verifications independently. And then you're also going to want to have this credentialing decision, which is when the credentialing decision is what you're saying is, I have verified everything. Everything is acceptable in the eyes of the state of Michigan standards for credentialing to say this person is appropriate to work with the population we serve. And therefore, a decision is made that they can provide the services. So many of our organizations have credentialing committees. That is required by the state and NCQA. The credentialing committee can be as small as 2 people. They really strongly feel it should not be just one person making a decision, that many parties should be involved. That's going to really be heavily dependent on the size of your organization, whether it's a credentialing department, whether it's an HR representative, a clinical person, maybe a quality person, a medical director if you have one. So you'll decide what's best for your organization and who should be sitting at that table to make a decision that this practitioner is qualified to work with our individuals and they can start now. Any questions about that? We're going to take a deeper dive into what proofs are accepted for each of these elements, but I wanted to take a minute to look at the application itself. Anything in the chat, Jen?
No, there's nothing yet.
Okay, great. So we'll move on. Again, this was just kind of a placeholder. We will send out the application to you guys after this training, so you have a hard copy that you can use moving forward. Okay, so we're going to talk about the staff verifications in the highest level of education. So NCQA and the state of Michigan require an official transcript. A diploma would not meet this standard. So you would need a hard copy from the university with its official seal. You could do an electronic download from the university with an attachment acknowledgement from the portal. You know, with technology these days, if I request my, you know, Wayne State application for my social work degree, they would just email my employer and then you would download it, and it's on the practitioner, usually to pay for that transcript. Now, a big question has come up as well. Well, what if the practitioner themselves brings me their official transcript? That is acceptable by NCQA and the state. However, you will have to provide proof that the envelope was sealed, that you've, you know, made a copy of this sealed envelope, and that it was inspected at the time that you or that it came to you, that it was sealed, and that you were the one that opened that document. So it takes a little bit of more of a proof effort when it's given to the practitioner directly, but it is allowed. Just don't throw out those envelopes and initial and date the envelope that you had inspected it and that it had not been previously opened. The last way of verification is some of our providers use a third-party vendor. An example is they're called National Student Clearinghouse. And a contract with that vendor would be evidence as proof that the information came directly from a primary source. So National Student Clearinghouse, this third party, what you do is there's a small fee. I want to say it's like $15, and you will request this transcript through National Clearinghouse, and it comes to you within 5 minutes. It's very quick turnaround on how they're able to access this information, and then the additional supporting document is that there is a contract in place with your organization and National Student Clearinghouse that that is the rule, is for them to pull from that primary source. Any question about the education history? Now, you only have to verify the education at the time of initial hire. Obviously, we know transcripts don't change unless maybe they get a new degree or they go back to school and then their job changes, and that's a whole other circumstance for credentialing. But for the purposes of, you know, I'm going to continue on this, you know, I have a BCBA, I got it from this university. That's only going to be one transcript, and that doesn't change every 2 years. A transcript is a transcript. So when you do it on the initial application, you will date an initial when you verified it prior to or at hire, and then every 2 years after that on the application, it will be NA. Okay, so we're going to move into the current license and verification of license. So this is where I'm talking about from the state of Michigan. You're going to have a copy of the current license, the actual hard copy that gets sent from the state. You'll have a little picture of it or scan it in. We'll accept many things right now. Previously, many people were able to scan it in. With some people working from home, pictures have come in and those are acceptable too. And then, in addition to the copy of the current license, you need to do a verification of the license from LARA, because we know that these licenses are valid for 3 years, 2 or 3 years, some of them depending on the license type. And we know why we want to verify them is to make sure that nothing has happened kind of in between those cycles, that the license is valid, there's been nothing, it hasn't expired, hasn't lapsed, and there's been no actions taken on the license. So those verifications must be completed 90 days prior to the credentialing decision. So when we're talking about that committee that's getting together to make this decision that this practitioner is able to provide services at your organization, you need to have verified that you have a copy of the current license on file and you did this LARA verification within 90 days. Previously, it had been 180 based on NCQA standards. With state contract for 2022 that is pending negotiations currently, they are saying that they're going to be making the change to 90-day verifications. So I am kind of moving forward with the mindset that that's going to happen, and that change is going to happen in our policy in the next few months to accommodate that state contract change. So all the verifications have to go on the more stringent, which will be the 90 days prior to the decision. And this is what those verification pages look like if you're not familiar, if this is a newer concept for you, as opposed to just having a copy of the license. So when you go to the LARA website, and I'm happy to provide links to any of these resources as we go on. You'll go onto the LARA site, you'll type in the practitioner's information, their name, and then their license type will pop up and you'll find their match, and then you'll click the license number. And then you'll get this, when you go to print, you'll see a little timestamp here at the top left corner, and that'll show, that's one indicator that it was within the 90 days, but you also want to make sure, well, just because I print it doesn't mean I looked at it. So I could print it off today, but maybe not look at it for 2 days. So your verification date might be a day or two after you print it on that application that we talked about just a few minutes ago, but you never want this to be after the decision. You always want to have one of these within 90 days. And again, you'll have this printout and it will have, license status active, expiration date, when that's coming up. If there's any other issues, you'll find that towards the bottom.
Monica, there is a couple questions about clarifying the 90 days.
Sure.
And is that 90 days after hire? What exactly that 90-day timeline is?
So the 90-day timeline is going to be when, so if we're talking about an initial credentialing, you essentially want to do all the verifications that you can prior to or at hire. So let's say you hired someone, they're starting on 3/1/2021, or let's just change it to 4/1/2021 because that's coming up in 2 weeks. You would want to have that verified. I would probably would assume prior to hire, because you want to make sure they're in good standing and have an active license. I'm assuming that would be part of your onboarding process as opposed to credentialing, which is okay. So let's say you get all these verifications done on 4/1. Let's say you do it right on the day they come into the office. You would want to make sure your credentialing committee is scheduled no later than July 1st, 2021, because you have that 90-day window where you have to make a decision. So you can do verifications and not have a decision yet, but you want to try to have that credentialing committee meet to say, hey, we have this new hire. We did all their verifications, prior to them walking in the door. Everything looks good. We have no concerns on our end. And then the decision, it gets made by this committee. And that's where that 90-day comes in, is you don't want to just do a verification at hire, let's say on 4/1, and then the committee meets in October. We'd be 180 days outside of or an additional 90 days outside of the timeline. We'd be 180 days past the time where they were hired. So what the state and NCQA are trying to do is have a level of oversight that these things are discussed and it's not falling on one person, that this person is eligible to work in your network. But they want to make sure the verifications don't hang out there too long, because we know a lot can change with license types or licenses expiring, or maybe a sanction check pops up. That's why there's that 90-day window, because they try to narrow it down how much things can change in that small amount of time. Does that make sense? Did that answer the question?
So the follow-up was just to kind of verify that they're understanding. So the credentialing committee needs to meet within 90 days of BCBA being hired. So Mandy, I know your question included BCABAs and QBHPs. Right now, this is only focused on BCBAs that we're credentialing. But yeah, so it would be 90 days within them from them being hired, correct, Monica?
Yes.
Okay. Yep.
So it, with the understanding that the verifications are maybe done at the day of hire. If you'd verified them like maybe at the time you interviewed, like a week or two before, you would want to, that's when the clock starts. Whenever the verifications start is when the clock starts. So if I start doing my verifications on 4/1, whether they're hired or not, or it's the interviewing stage or it's at their time of hire, the clock starts at 4/1, and you'd have 90 days to get them credentialed by your committee after that.
Okay.
Okay. And, other people have many license types. I know for today's purposes, Jennifer and I said we're focusing on the BCBAs because that's who we're going to be focusing on our audits when we come out. But obviously, if you start incorporating this into your practice day to day, you would incorporate your other license types. Just for auditing purposes, we're only going to start with the BCBAs when we start coming out to do the audits or virtual audits until we're back face to face.
So Monica, another good question just came in. So
Sure.
sometimes with our ABA network, which is probably a little bit different than others, the staff member could be working there for months or years, but not working on an Oakland County individual, and then they get assigned to work with someone from Oakland County. So then they're kind of officially, how do you want them to handle that?
Yep. So we would just treat them like an initial credential. Because that's when you are, they're starting to work with people in Oakland County, and we're saying they meet requirements to work with people in Oakland County's network. So you can start it as an initial file. And then after that, so obviously we know we're not going to look at the documents from prior to hire, but we'll look at the documents from that point on. So we have had that encounter with like the SUD network. Sometimes, they contract with another PIHP, and then they're like, oh, we're going to start seeing Oakland County folks. We just have them kind of start that verification process as an employee. Obviously, if they've been there 10 years, we can't go back and say, well, can you show me that sanction check from 10 years ago? We're not going to do that. So we're just going to kind of start them off where they're at. We would still, on the initial, we would still say, hey, that transcript you have on the file, let's dust it off a little bit and just make sure you verify that you have it for their file purposes, their most recent resume, those kind of things that we would still look at initially. We'll still look at, but we don't want the date from when you verified it when they were hired. Does that make sense?
So then the 90 days would start when they get assigned.
Yep, the 90 days would start. Yes. Mm-hmm. If they're going to be assigned a case, I'd probably start that process a little sooner to make sure they're credentialed before they start seeing that individual, if you can. If that makes sense for your network. Any other questions about the 90 days and the verifications for this piece? Okay. So board certifications, again, it's one of those other verifications that need to be completed within 90 days. This may or may not apply to your network. The only thing I'm going to say, because we're still waiting for some clarification from our consultant on the level of board certification, because previously we were mostly focusing on the doctors or the MDs or the DOs or the nurse practitioners, but we obviously know there's some unique board certs in the state of Michigan that are they looking for those when they say other practitioner types and in getting that appropriate specialty board. So if someone is board certified for whatever reason at your organization and they've identified as being board certified, we will need to see the certificate of their board certification and the verification from the certifying body. So just an example off the top of my head, I'm sorry, I don't have an ABA one as it's still newer for me as well. But for instance, right now we're looking at like a MCBAP certification, which is in our SUD network. It's a Michigan board certificate for addiction counselors. So it's kind of like a very smaller certificate, but what we would need is their little pretty certification saying, you know, their name and when, how long it's valid. And then we would actually go to the MCBAP website and look them up to make sure that there's been nothing, it hasn't been, you know, deactivated or any sanctions have been taken against their certification since they were granted it. So if someone identifies this, you know, because NCQA in the state does not require these certifications, but if someone self-states that they are, you have to do the verifications to support it.
Hey, Monica, there is a
Sure.
request. Can you make your screen bigger? They're having some
Oh, I'm so
difficulty seeing the
sorry.
screen.
I'm still, because I was in my back and forth mode. I am so sorry. Is that better?
Yes,
Okay.
thanks.
Wonderful. I'm so sorry about that. And then, and again, we will send out a copy of this PowerPoint too, so you guys will have this at your disposal to refer back to after this. So again, the key element here is it has to be reviewed 90 days. So if they're saying, hey, I'm board certified and you're starting to do the verification, that clock starts and you have 90 days. Okay. Criminal background checks. They're done prior to hire and then completed annually or every 2 years as identified by your agency's contract. And so in my contract research, you guys, it appears that your ICHATs are required every 2 years. So you would just make sure you do your one prior to hire and then every 2 years after that. National Practitioners Databank query. This again should be done upon initial credentialing, so prior to hire and then every 2 years after that. And that's another one that we want to see verified within 90 days that you make that committee decision. So there are some requirements in lieu of NPDB. Is if you don't have that query system and you don't pay for that service, there are those elements incorporated in the state contract here that says this is what must be verified, that there's a minimum of 5-year history of professional liability claims resulting in a judgment or settlement, that these need to be verified. Disciplinary status with regulatory board agencies, and Medicare and Medicaid sanction checks. So there's different elements, whether you would know this from pulling a state or federal sanction report. You would know this from their pulling their board certification status if they have one. And any liability claims, you would obviously know. I believe people get notified as people add people to their policy if they've had claims pending or something previously, or if you have someone self-attest to this information. So NPDBs only captures fully licensed master's licensed practitioners and higher. So I have this backwards. I'm so sorry. This should be licensed nurse practitioner. Oh, I just put an L in front of it. Nurse practitioner, medical doctor, fully licensed social workers, fully licensed LPNs or LPCs. I'm so sorry. So those are the type of things for NPDBs. Now in my baseline audit work that I've done for the ABA network, it appears some people are doing the NPDB and others are not. And so we went back to NCQA to say, you know, what's the expectation for NPDBs for the ABA network? And I didn't really get a clear answer. So and then when I went to the state contract, it does discuss it, but because of the license, fully master's license types, that might not apply to some of your practitioners as we're going off the BCBA. Anybody want to kind of fill me in what your organization's doing if you're doing an NPDB and or if you're not and why? We have a discussion about that a little bit. Is this something new people are hearing? They've never heard of an NPDB before? Because I am trying to get clarity on this answer for our network for the ABA purposes.
Yeah, my name is Delina. I'm from Acorn Health of Michigan.
Hi.
Hi, how are you?
Good.
So I have heard about this, but we are currently not doing this that I know of.
Okay.
So it's something that I'll take note of.
Okay.
I can also comment on this. This is not something that I was familiar with either. We recently went through a Macomb County audit, and they required this as part of the audit, which we were not conducting because we weren't familiar with this. I had never heard of this either. So we will be becoming more familiar with this moving forward because we will be required to do it for Macomb County as well.
Okay, thank you for that. And I know some of my providers that have Wayne County has been asking for this too. So I'm still looking for further clarification on it. Is there anybody who is currently doing this right now?
Strident Healthcare is doing it. We're signed up for the database to send us monthly emails regarding any activity, and basically you just get an email mailed to you on a monthly basis, and it says there's been no activity in the Databank for this month.
Okay, wonderful. All right, so it seems like, some people may be familiar, or it's coming down, the line because other providers are working towards NCQA accreditation too. So this might be something new that we're going to start moving towards, it sounds like. Again, as soon as I have more clarification from our consultant, she was going to look for this FAQ for me. I'll make sure that I get that out to you guys as soon as possible. If you are enrolled, continue to do what you're doing. If not, you might want to take this other route until we get a definite answer. But there should be a way that you guys can verify if there's been any liability claims resulting in a judgment previously in their workings as a BCBA, and then the disciplinary status on the boards and the Medicare sanctions and stuff that you're currently already looking at.
There is a question if this information can be pulled from the BACB, and I am not aware that it can. So the BACB is the credentialing board for BCBAs.
Okay. I'm not sure.
And I do not know the answer to that either. I'm not sure if it can be. I'm not sure if anyone else on the call that does this information knows if the BACB houses any of this. Monica, I do want to just comment too. I know we're really focused on the credentialing committee and what we need the credentialing checklist for, but there are some of these things that we're talking about that are required for your other practitioners, but Monica's, we're not going to be auditing them. So like you still need to do the background checks on everybody, and you're just not going to be submitting the credentialing application for those individuals. So I don't want you guys to just stop doing some of those other basic credentialing things that are required still, and get confused based on what we're submitting applications for and what we're not.
Yeah, that's a great point. So just kind of like on the first or second page of my PowerPoint, I do zone in, like I think the qualified behavior, there's one of those listed on my list of like practitioners. Yes, thank you.
And the BCABAs, you guys are still going to need to verify that they have the BCABAs still need a license in the state of Michigan, and the QBHPs, you still need to verify their education. What's different is those aren't going to be submitted via the credentialing committee process.
If they want to incorporate that into their daily practices, like just to have everyone's on the same page and everyone's being credentialed the same way, like that is up to the organization currently. Right now, the only reason I'm focusing on BCBAs is that's because who we are going to audit, and that who the state, when we do credentialing audits, they would pull from that pool of is just the BCBAs currently. So so when I say, hey, Strident, I'm going to come out and do an audit in July, I'm just going to look at your BCBAs. So we still want you to do the credentialing process and making sure things are verified for your other practitioners in your network. But the only ones I'm going to request to see at the time of the audits currently are BCBAs for right now. Okay. And kind of what I believe it was Strident who just said this too about this continuous monthly report, that they get a notification that nothing showed up in the bank. This is what she's referring to, I believe, is this continuous query subject listing. So if you enroll all your practitioners in the National Practitioner Databank, what happens is a report gets pulled. It'll tell you their enrollment period and how long they're enrolled for, like it's current. So these are the people that when she's getting that email saying there's no hits, these are the people that are all enrolled in it. So you know to add people, or if things are coming up expired, you know the enrollment date is going to be, you know, lapsing, you need to renew their query. But there is an extra fee to the continuous query and the monthly monitoring. There are people that run single query reports, and those are sufficient. Just some people, depending on the size of their organization, prefer to have them into the continuous query because it takes the guesswork out of it and it just runs it for you monthly. And you know that you're going to hit that 90-day verification because it's continuously running. Again, continuous query is not prescriptive. We do not require that, but it is an option for you as you start to enroll potentially in the future for the National Practitioners Databank. So this one is seemed to have dropped off somewhere with some of our provider network. I don't want to say ABA, but some of our other networks in general, is the Michigan Sanction Provider List. The Michigan Sanction Provider List is different than the OIG Federal List. The OIG Federal List looks at different Medicaid and Medicare sanctions federally. The Michigan Sanction Provider List is Michigan Medicaid Sanction Provider List. So this has to be run in addition to the OIG checks. Now, some people, as you see, I noted about Streamline Verify, Verify Comply. What is that? For those of you who are unfamiliar, those are third-party services who, when you run it through one of their data banks, it covers both the state and federal checks. So that would meet both of the standards in one-stop shop per se. Again, there is a cost associated with that, so that's why we do not require people to use those third-party systems. Just again, larger organizations find it beneficial, so they're not spending a lot of time doing sanction checks, the first Monday of the month or the first Tuesday of the month, and entering in all the names manually to do those verifications. Because with those third-party reports, you upload your entire list, and again, it just continuously checks monthly for you. You would remove staff that have terminated, and you add new staff that are new hires. It's a very simple process. I've added the link here. I'm going to click on it and kind of show you guys who may not have done a state sanction check before what's an accepted proof. So give me 1 minute for this to load. Might take a minute. Okay. So again, this link is going to be on the PowerPoint. I can always send it out separately as well. You're going to scroll down to the bottom of the screen and it'll say list of sanction providers. An Excel document will open up. It's thinking about it. And this report is updated very frequently. I think when I showed a provider this last week, it said it was just updated on March 13th. So maybe every 5 days it updates. And what you would do is you would set a time for your organization, whatever day works for you. Maybe it's the first Monday of the month. Maybe it's the third Thursday of the month. Whatever works for you guys, you have to be able to run your monthly sanction checks. So let's say for today's purposes, we are going to look up myself. I'm Monica Sanders, and because I'm a licensed master social worker, you're going to want to look for me. I just typed in Control F for the find function, so you're not going through this 137-page document. And you'll just go to find. So here are the Sanders that come up in the Medicaid Michigan Sanction Provider List. And you can see it's alphabetical, which is great. And so I would fall between Jarrett and Phillip. If I were to show up, this is where I would be. And you can see Monica Sanders does not show up on the sanction list. So what you would do is you would print this page only. Like I said, it's a 137-page document sometimes. I don't want you to kill that many trees. You could just, screenshot this, print this page. And what you would do is you would just write, verified, no Monica Sanders, 3/22/21, and your initials. and then your verification is done. And you would have to do this monthly for your clinicians. And you can see why like OIG doesn't typically capture things like home help or things like that. That's why the Michigan one is, there's not an overlap there with the OIG checks. Any questions about the state sanction checks? So those are, again, required to be checked monthly. And when we do an audit, we usually request about 6 months worth prior to the decision. So let's say I were to come do an audit October 1st of this year. I would ask for the monthly checks going back to probably April. And what that does is it just kind of paints a picture for the auditor to see that it's being done consistently and it's not being missed, that you've implemented this successfully in your process. But when like audit time comes and let's say the state of Michigan says, I want to see the file for Monica Sanders, they might ask for 2 years worth. Because 2 years is the time of our credentialing cycle. Any questions? I'm going to go back to the PowerPoint now. Okay. And the Office of Inspector General, most people are doing this. This has been a requirement for credentialing for a very long time. This is the federal check. Again, this is required monthly. That third-party software is still accepted as a proof document via Streamline Verify or Verify Comply. And you can do individual checks there. And so again, I'm just going to pop it up real quick just so we go through it if it's new for anybody who may be new to the credentialing process. So I'm going to just use myself because I'm popping in, I won't show up. And see, and there's my check right there. I would print this page. There are no results found for Monica Sanders as of today. So my next check would be in April 22nd of 21. And it has little timestamps for you and everything. So any questions about the federal checks?
I'm sorry, can I ask one question about the NPDB?
Sure.
Does that need to be done for BCBAs or BCABAs as well?
Well, that's what we're still trying to get clarification on because it sounds like only a couple of the ABA networks are doing it for BCBAs currently. And so I need to determine if that's going to be something for BCBAs across the board and then what other license types for the ABA network would fall into that. So I'm trying to get clarification for you on that. Again, credentialing the ABA network is new for me too. I've kind of mastered for the SUD and or core provider. So there's still some learning curves here. So I am looking into that information for you.
Okay, thank you.
Of course.
Good morning, Monica.
Good morning.
Next question in regards to the MDHHS and the OIG monthly reports.
Sure.
So have you guys have this process in place for a while?
Yes, this has been, these two checks have been in the credentialing policy at OCHN since I started, and I've been at OCHN about 3 years now, so that really hasn't changed because our policy outlines, and I'm going to send you guys out the policy too, is that, you know, that our network delegated providers who we delegate the credentialing task to are responsible for following our guidelines. And so that has not been changed in 3 years. I mean, at a minimum. It could have been in place a little bit longer, but since I've been doing credentialing, it's been in place.
Okay, so question in regards to the OIG, would you guys accept monthly verifications from Verify and Comply, or does it have to be straight out of the OIG website? Verify
Comply is perfect. If you have been doing Verify Comply, that is acceptable source. You know, here at OCHN, I use Streamline Verify when I'm doing checks on our network, and that covers both federal and state sanction checks. So if you've been running a monthly Verify Comply, that covers your state and federal checks for as long as you've been running it.
Perfect, thank you.
Of course. Great question. Okay, so we're gonna move on. So these are other documents needed for review to the credentialing decision. These are not NCQA requirements. These are ones from the state of Michigan contract. So these have not changed in quite some time. So the fact that we look at these, hopefully is not too much of a surprise for anybody. But again, it's more of a reminder that we do check for these, and reminding that there is a verification date that you look at it and say, hey, it's in the file, it didn't grow legs and walk away, and that someone initials it to who did that verification. So obviously the current performance evaluation, obviously your new hires, your initial credentialing folks, they're not going to have this. This will be an NA on the credentialing application. However, once you start getting them on their annual performance eval, when we audit, we will ask to see the most current eval. So obviously we'll know, if I do an audit next month, let's say, and you haven't done an annual performance eval in 3 years, we're going to know that's a little out of compliance, because they should be done annually per contract requirements. We are going to look for a current job description. That should be verified at the time you do the credentialing initially and re-credentialing. We know job titles change. Maybe someone has their BC, because it's not really affiliated to the license as more it is to their job. So because someone could get promoted to a supervisor, someone could get promoted to like the clinical director. And so we would want to see the job descriptions have shifted while their responsibilities have shifted. So there should be the most current job description of what they're doing on file. And then relevant experience is the work history, and we're going to talk about that next. The work history is going to be looked at for these initial credentialing files, because we know resumes don't change after they're hired. I mean, people change them when they start looking elsewhere, but not for these purposes. So it's going to be looked at initially, and then when the time comes for re-credentialing, you'll just put NA because you looked at it at their initial credentialing. This must include a month and year. Some resumes, people get into the history of saying, oh, I worked there from 2011 to 2014. We need to have a month and year based on new requirements from NCQA. I think the state has adapted these to more recently. And what they want to see is that there is explanation for a gap in employment for 6 months or longer for employees that have been at your organization less than 5 years. So if you have a longtime staff who's been there 5+ years, you don't really need to worry about them fixing their resume. If there's a gap in employment, you're not going to need to really look at them because they've been long-term staff. Anyone that has been in your organization less than 5 years, you're going to want to take a look at that resume when you're credentialing them and see if there was a gap for 6 months or longer. And you need to have a process, and this is not prescriptive, whatever this looks like for you, on how you capture that gap. This is not meant to be, this can be a source of contention. This is not pending employment. This is not, any reason to be terminated. This is just straight data collecting on why someone had a gap, and they want to account for this. So where is it documented? I've seen a wide variety because this is newer, we've implemented this only in the last 2 years. People write it right on the resume at the time of the interview, like, oh, we see that there's a gap, for a year. What was going on? Oh, I, took a long extended maternity leave. Oh, I went back to grad school, whatever. And it does not have to be very detailed. It could be a medical reason. They could write medical. They don't have to get into their whole dirty laundry per se, or anything that they're not comfortable sharing, but they do have to share what was happening. And just making sure that there's somewhere that you're capturing that process. Did you put this in your policy that you're looking for that gap in work history? Some people have a place for it on their employment application. Some people have created a cute little form to capture it. So it's whatever you guys want to do. It does have to be captured. Again, not punitive, data collecting to show why maybe they took some time off work for an extended period of time. That is a newer one in the network across the board. Everyone's getting used to this standard.
What if employees were to refuse to give that information?
Oh, you're throwing a curveball at me.
Well, my thought process is some people may not be comfortable, and it's right.
Right.
We're looking at if there is some sort of alarming information on their work, on their history, why they have a gap, like extremely excessive, but they went to prison. Our other checks would catch that. So it's kind of like, well, why does it matter?
I hear you. This comes up probably every credentialing meeting I have with our network representatives. You know, if they refused it, we do have this form at the OCHN level. It's a credentialing question. We would probably have you fill it out, and we would discuss it as a credentialing committee and see what we wanted to do with this individual. No one has really refused. I do know some people have modified asking the question until after they're hired, because maybe people aren't comfortable, like, oh, are they not going to hire me because I was a stay-at-home mom for 4 years? So maybe asking it prior to hire wasn't the right move for their organization. So they moved it to after, like at the time of orientation, after they're already onboarded, and they've collected that information. So they know it has nothing to do with their employment status. So most things that we've seen is people, you know, going back to grad school, it's people, you know, taking care of like a parent who got sick. It's, you know, personal medical reasons they don't even disclose. And we're not going to ask like, oh, well, you know, did they have cancer? Are they in remission? Are they going to be at risk of, you know, taking off more work? It does not go that far. We do not try to intrude on that kind of information. Again, it's just accounting for like caring, you know, taking care of personal medical, taking care of family medical, you know, going back to school. You don't even have to say what for. It's very brief. So just try to be reassuring at that point. And then, of course, if they really refuse, we can take it to committee at OCHN's level.
Okay, thank you.
Of course. So again, this is probably new for some of you. Detroit Wayne is going to start asking this if you haven't already chatted with them. Macomb, who's working towards NCQA accreditation, this is a newer standard. Trainings, you know, this is credentialing decisions don't necessarily have to be included. So we identify training on the checklist just to make sure that people are, you know, keeping up with the trainings, doing the trainings. But obviously we know certain trainings don't happen 90 days before the decision. You know, trainings happen, you know, upon hire and then, you know, ongoing after that, depending on what the training is. So really, when we look at trainings, we're not necessarily looking for that prior to, you know, 90 days before the decision like we do with all the others, but we are looking that their trainings are current and nothing has expired when we start to look for those training transcripts or certifications. So these are the ones that are listed in your guys' contract.
Monica, there is just one more question just about acceptable reasons for people to have a gap in employment. And if I'm understanding you right, we don't really need an exact reason. Like the example here was like, is COVID an acceptable reason? We're not really specific looking at that. We just need a reason.
Yep, we just need the reason. It's not if it's acceptable or not acceptable. We're just looking for a reason because again, it does not pend any decision regarding their employment. We're just accounting for a gap.
Thanks.
Okay. No
Hi,
problem.
may I please ask a question regarding resume and transcripts? We, in the latter portion of 2020, we went through an audit, and during the time it was shared with our organization that when we were looking at resumes as well as official transcripts, that we needed to kind of look at the document, compare it to the primary source during their hiring process. But every 2 years, we were also responsible for looking at it once more, dating it and initialing it. I did not hear you say that during the time that we reviewed transcripts and resumes during this particular training. So I just wanted to see if that in fact is a practice that we should be doing or if that's kind of null and void at this point.
Okay, was that an audit that you went through with us?
Yes.
Okay, so yes. That has recently changed due to some guidance from our consultant. So that's a great question. So previously we were having people attest essentially and re-verify that, you know, essentially the resume and the work history and the transcripts didn't get legs and walk away. That because we did not have a clarification in the standards because it said it was required at the time of credentialing, but it's like, well, that didn't change, obviously. So why would we need to re-verify it? So we just had people go through the motions. Yes, it's still here, it's verified, and I'm initialing it. We did get guidance from our consultant recently that and I changed the checklist to reflect this. If it's an initial credentialing file, we're going to verify it. We are going to date the day we, reviewed it, verified it. We're going to initial it. And then when it comes time for re-credentialing 2 years later, we are going to write NA because it was done at the time of the initial credentialing. And so we did make that language change on the application checklist.
Okay, that sounds good. Thank you very much.
Oh, no problem. Great question. Thank you. Yes, that has changed recently. Okay. So the credentialing application, we talked a little bit about it. These are the things that the practitioner attests to, and why we, again, this language is very specific. It's pretty rigid. If the link, I can tell you right now, when I first started off, someone had given me an application that said any history of loss of license and criminal convictions, and I said it was fine. I said I don't see a problem with that. Well, when NCQA came in 2019, they told me that it did not meet the standard because it did not say felony specifically. So this is not me trying to be rigid by all means, felony, criminal. I kind of just lumped it. No, they want to see felony convictions. And so that's why I have incorporated the attestation within your application so you capture the specific language so we know that there's no room for error and they're attesting to the exact things that the state and NCQA are looking for. So that is now part of the application. And again, the attestation must be signed within those 90 days of the decision. So once you start your verifications and you're giving the employee their application to fill out their portion, the clock has probably started or will be starting, and that has to be within that 90 days of the decision as well. I've had a couple people like, oh, they weren't in the office for that day. We did the verifications and we credentialed them anyways. Do not credential them. Just hold off. Get that signature ahead of time, because what happens is if it's verified after the decision, it makes the decision kind of null and not meeting the standards. It's no longer a clean, quote unquote, file, and you'll have to re-credential them from the beginning. Everything has to be done before that decision. If it happens after, you're going to have to re-credential them. Do the whole thing over. It's a lot of work, and I don't want anyone to do that. Okay. So again, we talked about this a little bit when we looked at the application, that those identified staff members are clearly identified. So if I'm seeing initials for 3 different people on those verifications, I want to see 3 different signatures so we can match the initial with the individual who did the verification. NCQA does ask that the medical director sign off on the application. We know many of our network providers do not have a medical director. So what happens is once we see that you have a clean file, or when I say clean, that it meets the state of Michigan or NCQA standards, we're going to present the file at OCHN's Credentialing Committee saying, hey, Acorn just credentialed Monica Sanders. She's good to go. Everything, all her verifications were perfect. And so then our medical director is going to sign off on that at that level as the delegating organization. So that's how we kind of meet that standard, is that because we have that oversight piece is that we're auditing and it's presenting to our committee. And the application should clearly reflect the date of the local credentialing committee decision. Sometimes people get through that whole application process and they did all their verifications and then they stop. We need to have a date because that date is so critical, because if we don't have that credentialing decision date, I can't decide or determine if it's within 90 days of that credentialing decision. So that's why that date is very key, because that's the date that I put in our audit tool, and it's going to calculate the amount of days that the verifications were done prior to that date. Okay. Credentialing policy and procedure should be clearly outlined by your organization that reflects OCHN's policy regarding credentialing. So I will have that for Jennifer to email out to you guys. I do have a copy of OCHN's policy, so it's not super long, but it'll help you guys understand some of the requirements and maybe incorporating some of our policies into your own policies, copying, pasting things that we know are required that maybe your policy doesn't have. You'll have a good example, a good foundation. And then the Credentialing Committee is responsible for reviewing complaints and adverse events. So when I talk about that, the credentialing committee, when all these verifications are done, everything looks great. There needs to be an opportunity for discussion. This wouldn't necessarily occur on your initial, there might be something that comes up, but I can't think of an example, but mostly in re-credentialing. You're going to talk about, hey, you know, we're looking at Monica Sanders. She's had 2 rights complaints about dignity and respect. Both were substantiated. Her boss has her on a performance improvement plan because she doesn't get her documentation done on time. You know, someone called customer service on her because she was rude. So these are some things that you're going to want to capture at your organization that you're discussing as part of the credentialing decision. You know, everything was verified and looks okay, but she's got this internal stuff going on that maybe we don't want her to work in our network because of these substantiations, these performance improvement plans. So you're going to have a discussion about those at the time of the credentialing decision. Before you make that final decision, you want to review that. So whether your organization has someone that tracks your rights complaints, an ombudsman or such, maybe you have your HR person handles your grievances, or you know, person served complaints that they didn't take to a rights level, but they had a concern about somebody. You know, you're going to talk to their supervisor. You know, are they performing well? And you need to have a documented process on what that looks like. That so we can say, okay, so you guys reviewed these. How did you review them? And so I was just going to show you an example of what OCHN uses, and we'll share this with you guys. Again, not prescriptive. This is not required. It's just what we use to help us meet this standard when we're audited at our level. So we have an area to discuss sanctions, like, okay, you know, this is the month our credentialing committee is meeting, and you can write NA. Maybe none of your staff have any sanction checks, or these would be NPDBs, I'm sorry. And then these are the state license limitations. So for these 2, I typically do these for OCHN because I do the Streamline Verify report. So I highlight anything here that might be concerning. Member specific complaints. We send this out to our recipient rights manager and our customer services manager to complete based on who's being credentialed, and then identified any adverse issues. So maybe there's been consultation with a supervisor or something that they're having some performance, or an HR person would comment here. It's just how we track it. We have this form at all of our credentialing meetings to review with the group. So you can implement it. You can do your own thing. Maybe you already have your own process. I'm not asking you to change it, but you have to have a process that captures this. Okay. So this kind of talks about the credentialing decisions. And this is all outlined in our contract. So I'm not going to read it out verbatim. These are just kind of talking about, this is mainly talking about an appeals process, that we just want to make sure your organization has something in place that allows the practitioner to appeal an adverse decision. So if you said, you know, we're not going to credential Monica Sanders based on X, Y, or Z, there's an opportunity for me to appeal that decision. And these are some of the guidelines that's requested. This is rare. Again, I've been doing this for 3 years now. I have not seen anybody appeal an adverse decision, because usually there's no adverse decisions being made. Usually everyone has been good with all their verifications and discussions. But if this comes up at your organization and you have concerns, we can kind of talk this through. But we just have to have a process in place on allowing the practitioner to have this request and this appeal. This is the big one that I want to have a little bit of a discussion on and take some time. So many, I don't want to say many, some of you use CAQH to do your credentialing verifications. This is an acceptable credentialing platform to verify credentialing information. This is accepted by NCQA. The state of Michigan will obviously accept it as well. So, however, where the CAQA, where there's been concern or things that kind of don't match the process, is we kind of have to close the loop. So CAQA does these verifications. So I'm going to back up a little bit. Your practitioner uploads their information into the CAQH system. They have to do this quite frequently from what I'm hearing, sometimes quarterly. sometimes less frequently. They're updating it based on your healthcare plans that you're affiliated with or your insurance companies. So they're doing this pretty regularly. And what is your process to ensure the practitioner's application is accepted? That has to be clearly outlined, because so we want to know the practitioner is doing it, and there's kind of an oversight mechanism, like they're doing it, everything's been accepted, they're good. On that end, on the CAQH end, you know, how do you know it's not good? Did something get declined? Was something not uploaded? Was something missing? We weren't seeing some of those elements of oversight to that within your organization. And CAQH, you're paying to do a wonderful service. They do a lot of really great things from what I've looked into. But what are you doing as your organization to kind of close the loop? Okay, CAQH did their verifications, everything's good. Now what do we have to do on our end? Making sure, you know, do we screenshot that the application was accepted so we have that in their file that they're good? You know, did the CAQH find something on their verification that needed to be followed up with? What's that process look like? These things have to be implemented in your procedures and policies, so us as the auditor, the state as the auditor, can kind of know how to navigate that, because without it, the process kind of stops. And no credentialing decisions are being made based on some of these verifications. So if you want to use CAQH as part of your credentialing process, we are all about it. We do not want you to, you know, redo verifications that you're paying a service to do. But if all the verifications are accepted, you can use that date that CAQH has accepted it and put that on your application. And when you are, and you can write in the initials of verifications, you know, CCAQH printout, or, you know, CAQH. And then there's going to be stuff we know CAQH doesn't capture, like the stuff that we just talked about, like, you know, did a supervisor have a performance issue? You know, are there rights violations? CAQH doesn't capture some of those things. So you still need to fill out that application kind of based on that information. So it might be a split role, but there has to be, you know, something to bring it all together, if that makes sense. So again, we know CAQH requires these verifications frequently, which is definitely more so than the 2 years we require. So this won't be done every time. So there will have to be a process kind of in place, like, okay, you know, CAQH verified it, you know, March 1st, 2021. We are going to look at the CAQH verifications on 3/1/2023. So, and then identifying who at your organization is responsible for kind of monitoring the CAQH activity, and not just in capturing this information for the employee file. So this should all be in your documented policy and procedure if you are going to use CAQH to do some of those verification checks for you. Can I ask, you know, and you can write it in the chat or just speak up, how many of you do use CAQH?
This is June Merritt with Health Call of Detroit.
Yes.
We use CAQH, and they have recently changed their procedure. We, at like the end of last year, we had to do a screenshot, but now they produce an attestation page saying the date that they attested, and they are not allowed to get to that page unless everything is done. You know, I've had a couple of employees come to me and say, hey, I can't attest. I said, that means something is missing. You have to go back and, you know, see what's missing. And each time it's something that they forgot to upload or didn't fill in some gaps. But now they are providing an attestation page that can be printed.
That's wonderful to hear. That's actually a great way to kind of close that loop, because, you know, based on CQA, if everything has been met, they're able to attest, and then you have that. And so you're able to take that, what CAQH was able to verify, and then you kind of would incorporate the other stuff that CAQH doesn't, like the things that we just kind of talked about, and then use that when making your decision. So if the time started, you have the CAQH verification approval page that says, you know, they attested to everything 3/1/2021, you want to make a credentialing decision within 90 days after that.
Monica, just coming in from the chat, it looks
Sure.
like Metro EHS uses CAQH, Acorn, and university pediatrics.
Wonderful. Okay,
And,
so
and health call. We know health call as well.
So
Trident does as well.
So we say this is about half then of the ABA providers? Is that a fair statement, Jennifer? You know how many there are total off the top of your head?
Yeah.
Okay.
Maybe a little under half exactly.
A little under half, because I know some of the core providers don't use it. So
yeah, so I don't know too if other people do use it and they just haven't responded yet. So
okay. And then, you know, and I'm just putting this out there again because this is a learning experience for everyone to kind of get everyone onto this NCQA and also meeting the state of Michigan standards path. Is this similar practices that other PIHPs are doing? Is that they're accepting the CAQH for your credentialing and then having you guys add the things to an application that CAQH doesn't capture? Or am I asking extra work for you guys? I'm trying to make sure that I don't want anyone to do duplicate work because, again, like that's my biggest thing. But I also see that there are some things that are not captured to close the loop and have this credentialing decision. Does this seem about right, on the right track?
I think most larger insurance companies are moving towards the CAQH for all of the employees that they want to pay claims on. I think they're moving towards that. I should also add that, first of all, this is June again.
Hi, June.
And I was late to the meeting, and I apologize. I'm on my way into the office. But I had a question that you may have answered earlier on. And this is being recorded, if I can get a copy of it, that would be awesome. Detroit Wayne Integrated Health, you already know, went from Well Place to MedVersant.
MedVersant,
And at one time, and Raquel kind of touched on it a little bit, Raquelia, they require that the current employer had to be on the resume. So even if you had a up-to-date resume, you got hired in, you're all set and was credentialed, you had to go back, update your resume at your current employer. But November of last year, they changed that when they started using MedVersant. And as long as there are no gaps in the resume, then you didn't have to have your current employer because that goes on your credentialing application. Is that something that you require? Do you have to have like health call on the resume?
So, yeah, we did talk about this a little bit. So we do not, at this time, we do not require people to update with their current employer. So if you hire somebody and the resume you get at hire, that's what we accept is the resume that you get when interviewing and, they're hired in. We don't have them once they're hired in, update their resume to reflect the current job. We do look for those gaps in work history though.
Okay.
So that is something that we are requiring. But yeah, we have not, our consultant had never directed us to get an updated resume at this point. So just making sure that you have a resume from the time of hire, that when you initially credential them, and that you looked for that gap at that time. And yes, June, just so you know, this is being recorded, and our training director will get this on our YouTube channel, and we will share the link with you as soon as that is uploaded.
Thank you so much.
Of course. So I just wanted to make sure, I was trying to incorporate the CAQH for those of you who use it into the credentialing process, because what we were noticing when we were doing some of our baseline reviews is that CAQH was great for the verifications, but the organization is still responsible for a credentialing decision. And that was the big piece that I was not seeing consistently for the baseline. I'm not saying that others that maybe I didn't look at don't have that. So just making sure that, you're looking at it as a helpful tool resource to come to that credentialing decision, because it is accepted for verifications. And we know that they're uploaded very frequently, which is great. So you should never really be outside the timelines. Okay. Now, the last thing that we're going to kind of talk about, we're getting close to the end and I want to open up some room for any additional questions, is how do we credential the ODIN or the ABA credentialing decisions in ODIN? So this came up as a, kind of difference in, semantics. Credentialing for so many people means, oh, I'm looking up the LARA license, it's their credentials, I'm verifying that. So what we're looking for in ODIN is the actual full decision, that decision date that I stressed is so important, and how to get that information in ODIN. Well, we know many of you guys don't have access to ODIN, and that's okay. Same thing goes for our SUD network. And so they do this process. They've been doing it for a year now, and it's working very well. If for some reason we find that this might not be a helpful tool for you guys, we can always change that. But we're going to try this out the gate to kind of get us getting the most accurate information on ODIN, because that's how I know how to audit. When I pull a report on ODIN, I pull everyone's credentialing decision in our network. So I can see, what core providers had staff, credentialed in the last 6 months, what SUD providers, what ABA providers. And that's who we know who to say, hey, these are the files I want to see when I audit. But it only helps if I have the right credentialing date and we all are on the same page with what date you have and what date I have. So this is the process we're going to incorporate, and Jennifer, this will be on your PowerPoint as well, and Jennifer will send out this link. We're going to capture this information via Smartsheet. So I'm going to click it. I'm going to show you what's going to happen. Okay. When you click that link, it's going to take you to this form. You are going to fill this out at the time someone is credentialed. I don't want you going backwards. We're just going to do it as it comes and kind of and get everybody up to speed. So you're going to enter the practitioner name. So I'm just going to do an example one. I'm going to say I work at Acorn. I'm going to leave the site location blank. I'm going to say I'm a BCBA. My date of hire, you're going to, I'm going to say I was hired March 1st. And let's say you guys got me credentialed in 2 weeks from the date I was hired, and that you gave me full credentials granted. From there, you're going to click here and upload my credentialing application. Just the application. I don't want to see all the proof documents. I just want to see the application, because it's just essentially making sure that the date that you wrote here, the 3/14 date here, matches that date on the last page of the application, and that's what I'm going to put into ODIN. When it's time for auditing purposes, we'll tell you how we want the proof documents submitted to support that application. But for just this purpose, just for the data entry into ODIN, we are going to just do the file upload and then this form. And then you're going to hit submit, and it's going to take, what it's going to do, it's going to alert Jennifer and myself that someone has been credentialed in the ABA network. And then one of us will update that information in ODIN. So I have the most current date of their last credentialing decision. Any questions about that form? Again, this is mostly just because you guys don't have access to ODIN, and we can put the data in ODIN for our reporting and audit purposes.
There was just a question again about what needs to be uploaded, and that's going to be the credentialing application that you have to upload.
Yes, just the application. I don't need the proof documents for this purpose, just the application itself. So just this here. That's what.
And as we mentioned, we're going to be sending out all of these documents, including this application for you guys to use.
Absolutely. And so Jennifer and I were talking, how obviously we know not everyone has been kind of doing credentialing this way. We kind of took account about how many BCBAs are in the network, how to get people up to speed, making sure everyone has the most accurate credentialing information. So how we did it for the SUD providers is we had people re-credential them at the time of their anniversary to get them kind of back on track if they haven't been doing it this way. I want to preface that because if you have, if you're using CAQH, I'm going to talk about that next because I don't want to mess up any cycles with that, obviously. So if you're not using CAQH and you haven't really been doing this process to this magnitude, what we were looking at is anniversary dates. So meaning if I was hired in January of 2015 and I really haven't had a credentialing decision, I would want to make sure that I am updated before January or at January of the next time it comes around. Like, you don't have to rush and try to credential everyone in your network today. Please don't do that. I don't want you, because what happens is all those people are going to need to be re-credentialed in 2 years. And so you're going to have these people on the same cycle, and it's going to be very overwhelming to have so many people credentialed at once. That's why we kind of did it by anniversary date to help people get caught up. However, some of you guys only have 8 to 10, maybe even less BCBAs in your network. If you are comfortable doing, 1 a month, 2 a month until you're caught up, do that. Because there's not that many to kind of stretch it out over the whole year, if that makes sense. So go ahead and at your, as you're able to do so, update these people who haven't been credentialed and get them credentialed and get them on a current cycle. So we'll start fresh. Obviously, they're already hired. We can't do some of those things over, but we can start new and start on the right track and kind of go every 2 years from that point. For those of you who use CAQH, you're on a cycle, a very specific cycle, and I'm not trying to mess that up or create any in-between work for you. So I would like to say for those folks who have a CAQH cycle coming up, like it's their time to start uploading stuff to that system, and you haven't had a credentialing committee date as outlined in our policy, go ahead and use the next cycle of your CAQH to start that clock for you and get them credentialed with a credentialing committee decision. And then once that happens, then you'll re-credential them every 2 years after that. But I want you to stay on that cycle because, again, I do not want to create more work from you or going outside of that cycle because that's just going to mess you up, frustrate the practitioners who have to upload all that information. So just do it based on their next updated cycle. If you are already ahead of the game and you're doing this, you're doing everything that we kind of talked about and it's been happening every 2 years and you have these decisions, go ahead and just reach out to me. I think that would be the best way, and we can work on getting the correct dates into Odin so you're not uploading a bunch of old applications or anything. We can kind of work on just cleaning up Odin together over the phone or something. We can do that if you're already doing it this way. But if you're not doing it to where you have a decision and it hasn't been happening every 2 years, this is kind of like the plan that I'd like to see take place to get everyone on the right track. Does that sound good?
And Monica,
yes.
I would say too, just as a reminder, so any new BCBAs that are hired in from this point forward,
yes.
do this from the get-go, please, so we don't have to go back. So anyone new coming in after today, start this process, and then again, there was a question that I wanted to clarify again. So for the purpose of this process and the credentialing application, it is only for BCBAs. However, the requirements for your other ABA staff, the credentialing requirements for QBHPs, BCABAs, and technicians, that process doesn't go away. Those staff still need to meet all those credentials. You're just not completing the credentialing application for those staff. You're not uploading anything for those staff. Does that make sense to everyone? I don't want you guys to just stop credentialing those staff,
right?
Because they still need to be credentialed, just not through this process.
Yeah, it's just another example, just kind of paint the picture. So like, for instance, NCQA only looks at fully licensed master's level clinicians and higher for our like core providers. So LMSWs, LPCs, NPs, DOs, MDs. I don't look at the limited license staff, but they are aware that they have to keep credentialing them and taking them to committee. I'm just not auditing them or looking at them. They don't need to be uploaded to a smart sheet, but making sure that you're still doing those verifications for all the other license types that are required in the state of Michigan. I just might not be auditing them. We might not pull them for a formal audit. So just make sure you're keeping up with those.
Right. And the state could pull them in an ABA specific audit because they have in the past.
Right. So we just kind of wanted to get the BCBAs on track because we know that pool can be pulled, first in terms of audits for credentialing, and then we can start looking at some of the others as we get on track and you guys are getting more comfortable with this new process with this state and NCQA standards. In addition, just on the last page of the PowerPoint, when it gets emailed out to you guys, there is a form. If you want to give me an eval on how I did or what you'd like to see differently. I do try to do trainings very frequently, especially newer to the standards provider. So like I did 2 SUD trainings last year. I'm hoping that, this is kind of going to be our kickoff. And then as we do some audits and kind of see how things are going, maybe we'll do another one in the fall, early winter to just say, hey, this is what we're still seeing. This is some patterns we're seeing, those type of things. So you can always write any comments. I love the feedback. I'm still learning too. I want to stress that the ABA network credentialing requirements are newer to me. I'm consulting with our NCQA consultant. I'm looking at the state contracts continuously to make sure I have the most up-to-date information for you guys. So I'm actually going to stop sharing my screen. I know we gosh, the whole hour and a half, but I'm available for questions. Don't feel like we are, anyone has to rush off. I can answer any questions anyone still has.
And as
I have a question. So this is relating to the last statement that you made in regards to making sure your other staff is going through the same process, although you won't necessarily be looking at them. I do understand that today's training was specific for BCBAs. So outside of BCBAs, BCABAs, QBHPs, when you say make sure you're doing this for your other staff, can you be more specific and share the other staff members that you're referring to, like those positions that you're referring to?
Share my screen once again. Oh, of course, it took me back. Not going to let me make my screen bigger, so I'm just going to zoom in. Okay, so on page 4 of the PowerPoint, these are the staff identified in the state contract who are required to go through the formal credentialing process. So like how Jennifer was mentioning, the other license types like BCABAs, they're not listed on here, but the qualified behavioral health professionals are. So just making sure if any of your clinicians are these license types identified here, those are the ones that should go through that formal credentialing committee process. If they are not listed on here, do your verifications how you've been doing them.
Okay, thank you.
Of course. Any other questions? These are great questions, guys. And thanks for giving me some insights too onto what people are doing as I'm learning.
I was just going to add again a reminder that I will send out everything later on this afternoon. And then as soon as we have the recording of the training available, I'll send that out too. I'm not sure if that will be ready by this afternoon when I send out all the documents, and I don't want to hold up all of that. So you might get a couple emails from me moving forward, but you will get everything from today. And then I'm also going to post all of this onto our ABA provider page where we keep all of our other documents. And I'll make sure to include a link to that page specifically too, because I know some of you might not have that already, as you're not the primary ABA people that I work with.
And I just want to add too, and I'm sure this will not come as a shock to anybody that works with other PIHPs or has just been doing this a very long time, is I do my best to get you the most updated information possible. With that being said, the state makes contract changes yearly. The NCQA issues new standards yearly. So things can change. I've already modified this presentation I've done 4 different times with different information that we've gotten, with standards changing, with requirements changing. So I tried my best to keep up with it. So if I train you today and we, log off, and then the state contract, I was telling you about the 90-day change comes in October and there's other changes that maybe we didn't discuss, I will either, like I said, do another training or send you guys an email saying, hey, oh my goodness, in addition to this requirement, now this is an accepted proof, or this is changed, or this is the new timeline. So, I apologize that it's a forever changing field. That's out of my control, but I do my best to make sure that everyone gets the new information as quick as I get it. And I can make this as easy as possible for everyone. I know credentialing is challenging at times, and some of you have a lot more people than others. So bear with me. I'm here to help always. If you have questions, you can always call me or email me. I'm happy to help in any way I can so you feel successful and confident in doing this. And then Jennifer can also send out my contacts, and I've been on some of the emails to you guys directly. So if I'm a stranger, I'm going to put my information actually in the chat right now.
I have one last question, and I promise it's the last thing I'm going to ask.
No, this is why we're here.
I do know that you're going to make the recording available to us, but I wanted to know if you can also make the PowerPoint in a PDF version available as well, so that we can quickly reference some of the information if we need to go back and review some things.
Yeah, I will. I do have the software. I've just never changed my PDFs, but I'm sure I can do it. I just haven't. Okay. So right now I can send out the PowerPoint for sure as is, and then I can always circle back and get you and try to do it that way.
Okay, thank you very much.
Of course. And again, any other tools or resources, like I said, I think we captured a lot of stuff today, like the policy we're going to send out, the oversight monitoring form for those grievances or adverse events, you know, the application, the PowerPoint, any tools that I can give you, I'm your girl. I'm here to help you. And again, there was that form at the top of the screen. I'm going to paste it again here for you. If you have a contact that we should be reaching out to specifically for credentialing, that is in the chat for those of you who may have joined the call late. So if I don't have your contact information, or Jennifer doesn't, and you heard about this through another staff, please fill out that form so we have your contact information and we can make sure that you get the latest and greatest about credentialing.
And what I'm going to do is I'm just going to attach all those documents to the meeting invite. So anybody that was invited to this, even if it was forwarded, will get everything. I'm not going to send out a separate email, just so I make sure to capture everybody that's here today. But please do fill out that form, because especially a staff change and update, sometimes we don't get that information. So we need contact information accurate as much as possible.
And my last plea too is, again, like I said, you know, we're all in this together. We're all learning. We're all trying to get with NCQA and the state contracts. If you hear something blatantly different from what I'm telling you from Macomb County, Region 10, Wayne County, shoot me an email. Let me look into it. You know, standards are a wild thing. You know, everyone has their interpretations. We work with different consultants who have different interpretations and experience. Let me look into it for you. But before you say, well, I want to do it Wayne's way, or I'm not doing it this way because Oakland said, the goal is so it's consistent across the board. So if we can all work together, if I'm not hearing about it, I don't know what's happening. So feel free to shoot me an email if Wayne County or Macomb or whoever is telling you guys something. I don't want to say they're wrong. Let me look into it, because maybe I'm wrong, and I'm happy to admit that and get you guys the right information. Thank you guys so much. I know we went over a little bit on time today. Again, my email address is in the chat. Jennifer will email everything out, and it was so great training with you guys today and having the discussion. Take care, everyone.
Thanks, everyone.
If there's no more questions. Bye-bye.